lives,
Yeah.
right? Because of the
They
way
know
that
what to expect, yeah.
Okay. What is your least favorite skill to teach?
I'm gonna say feeding, only because feeding seems like something so simple and like you've learned since you were a child, and to teach someone that's 80, 85 to feed themselves again, it's difficult, especially when even to teach someone to use their opposite hand to feed themselves. I mean, you see a lot of frustration, you see a lot of disappointment in patients when they're trying to learn how to feed themselves again. So I'd say that's the most difficult.
Okay, what is your favorite skill to teach? Or maybe, what skill do you see the most joy from out of your patients? Possibly, if there is one.
I mean, it overlaps with physical therapy a lot, but I would say that teaching someone to walk again, stand again, transfer themselves from a chair to another chair has the most joy, because, I mean, everyone wants to walk. That's what most patients come into the facility and I say, what is your goal? To walk again. I mean, so to see someone who can't even stand to learn how to walk again is very rewarding.
Okay. I know we've hit on this a little bit in the previous questions, but what motivational technique specifically do you use? Maybe to motivate, a client that, doesn't want to cooperate with you that morning, or, doesn't feel like listening to you.
Food, bed, telling someone that they can, I mean, everyone, the motivation level is very, very low in these patients. So, I mean, telling them when we're done, you'll be done for the day, or when you're done, we can lay down and take a nap, or when you're done, I'll get you an ice cream sandwich.
So why do you think their motivation level is so low? Because of the age of your patients?
Yeah, age, like their body has gone through, like someone who had a surgery or someone who fell. I mean, for a 20-year-old body to go through it and a 90-year-old body to go through it, it's totally, I would want to sleep too. But I mean, using even like, if I don't want to walk today, let's go outside and take a walk. So using external motivation is helpful.
Okay, do most of your clients show an intrinsic level of self-determination or an extrinsic level?
That's what I sort of said, right?
Well, I mean,
Extrinsic.
so you're basically, well, let me rephrase that. Is there a specific percentage of clients that actually have intrinsic motivation? Have you come across people that are
Yeah.
actually,
Usually the young, like knee replacements we get, or the 50, 60-year-old patients that were active prior
yeah.
that want to get back to their previous lifestyle.
Okay. Well, I mean, obviously, most of them need that extrinsic level and motivation from an outer source. Okay. What or who influenced you to become an occupational
Oh my
therapist?
goodness. I volunteered at Shriners Hospital for Children, initially thinking I wanted to work with children, but I mean, just helping them. I think it was an after-school program and like a exercise after-school program. So I mean, that got me interested. They worked with the occupational therapist in the program, and it was between physical therapy and occupational therapy. And I feel more rewarding out of the occupational therapy.
Awesome. Well, it was a pleasure interviewing you. Thank you for your time.
Thank you.